Just waiting for the feed to resume. Okay. Now that I'm visible, so a very good evening to all the participants, residents, all the audience who's joining it here. Some of you know me already. Many of us may be meeting for the first time. This is Dr. Sandeep Sharma. I've done my MD Pediatrics from PGI Chandigarh, and since the last 10 years, I have been training people, I have been training students in various competitive exams like NEET PG, FMG, INI-CET, NEET Super Speciality, INI Super Speciality. And today there is a reason I'm here. I'm here to talk about a program which I personally felt since a long time that I would do something about it. And finally, in collaboration with Dr. Tutorials, we are going to come out with this program. Uh, very good evening to Raju Nayak. Very good evening to Mohammad Suhail Alam. So many of you will be joining me live. I will be taking your doubts here. Some of your doubts I will be responding later also. Many of you message me saying you have duties right now and you cannot join immediately. So it's absolutely fine. So the recorded version of this video will also go up. The thing is, I know it's very tough being a pediatric resident, and it's not always easy to take out time from your busy clinical postings and join a live session. So I'm going to talk about a program that is PG Residency Program, also called as a PG Curriculum Program. It's a special effort on behalf of Dr. Tutorials, and very soon, in the next couple of weeks, we will be launching the program. This is a unique program by itself. This is a program which has been created only for pediatric residents. It's exclusively for pediatric residents. Now, obviously, the first question which will arise in your mind is, sir, how is it going to be different from the super specialty programs? There are already some super specialty programs related to pediatrics. We need to understand that most of the, I would say all the current super specialty programs in pediatrics are MCQ oriented. Solving an MCQ in exam is a totally different thing. And clinically examining a patient, making a history, making a diagnosis, presenting it in the exam, finding the appropriate approach to a patient, and then actually following up the patient is totally different from that. So there is always a need for a specific program like this. Over the last few years, I have been resident and I felt that there is always someone to help you in hand holding. Yes, there are a lot of medical colleges in the country where there are good academic programs which are available. But in general, what I see is there is a positive, because sometimes, number one, academics are somewhat lacking. Even in the same medical college, not all units will be teaching to the same level. Like they will not be all of them will not be academically oriented. Some of the places you will find that the hectic postings are there, and even if there is academic program going, all you end up doing is simply attending it and sleepwalking through them. So there is always a possibility that you are missing out on some appropriate clinical information, and this is this gap that we aim to bridge through this program. Let me be honest, let me be clear. There is no alternative to bedside teaching. There is no alternative to you physically examining the patient, learning from bedsides, learning from professors. But if you feel that after attending your clinics for your exams, for understanding the finer nuances, you need somewhat hand holding or some push, this is what this program is all about. So, since most of these super specialty programs in pediatrics are MCQ oriented, and there is a relative paucity of material for clinical teaching alone, this is what this program, the PG curriculum program, tends to bridge. There is a difficulty in squeezing out time, and so we are going to make it crisp. At the same time, it is going to be a dynamic program, and many excellent clinical manuals are available for pediatrics, but many of them are very bulky, and we don't really get time to read Nelson. So reading about the clinical manuals, the multiple manuals, becomes a cumbersome process, and that is what we are going to simplify here. Obviously, the first thing the question will arise is that who are the team, who are the people who will be teaching you here? First thing is, I will be there. I'm Dr. Sandeep Sharma. I've already told at the beginning of this session, I've done my MD Pediatrics from PGI Chandigarh. Um, I had the privilege of being trained under some of the sharpest, finest minds in the country, even though I consider myself to be a very average pediatrician. But I personally feel that the kind of environment I have felt at PGI Chandigarh, I had the opportunity of working under some of the best minds in the private sector also. So I've learned those nuances and I want this platform to share it with you. So in general pediatrics, nutrition, in rheumatology and certain other allied things, I will be the one who will be handling it. Apart from that, we also have an eminent team of pediatricians helping you out. We have Dr. Sudeep Verma with us in this program. Dr. Sudeep Verma is a practicing pediatric cardiologist at Hyderabad. Sir has a distinct flair for teaching pediatric cardiology. And I used to think that I know cardiology very well. When I saw Sir's video and when I interacted with Sir, the way he explained the finer nuances of ECG between ASD, VSD, PDA, such simple things. I was totally, blown away by the fact that here is a master. So that was the time we actually requested Sir that, Sir, you take up the pediatric cardiology and Sir will be handling the pediatric cardiology part. So ranging from things like basics of ECG, basics of echocardiography, how you are going to manage a patient of acyanotic disease, cyanotic disease, bedside management, how do you do complications if they happen, how you are going to manage the clinical things that sometimes you find in the books but are unable to understand, things you don't find in the books. Sir is has worked upon that, and sir, many videos are still in process and very soon they will be available. So Dr. Sudeep Verma is with us for pediatric cardiology. We also have Dr. Parag Dekate. Dr. Parag Dekate sir has been my senior resident when I was doing my junior residency at PGI. Sir is a PGI alumni. He's an expert. He's a consultant in pediatric critical care at KIMS Kondapur in Hyderabad. Parag sir has been very strict in my days. Sir has scolded me a lot. At that time, I used to think sir is very strict. He keeps very high standards. But now I feel those high standards were needed, and those high standards, without the scolding part, you are going to get in this program. Sir will be handling the critical care part. Uh, yes, some parts I will also be handling, but sir will be taking up the core critical care part, how to handle emergencies, how to manage respiratory distress, the PICU care, the common poisonings, the common ventilation related strategies. Those things will be handled by Dr. Parag Dekate sir. In addition, there are other specialists. There is a complete team of pediatric PGs and residents who will be curating this stuff, who will be writing and making the background activity for you. So you are going to get a lot of in addition, what we will be planning in this program is there will be guest lectures from some of the eminent faculties also periodically. So if you are a subscriber of the course, you will be getting access to live interaction and you will be getting access to exclusive closed privileged rooms where you will be able to access through Zoom the discussions on various things, and there will also be separate segments for biostatistics. So if I have to summarize what is the course content going to be, there will be history taking from a resident's perspective, not from a newbie's perspective, not from an MBBS student's perspective. Yes, history taking will be the same, but the finer nuances. General physical examination modules will be there. System-wise examination modules will be there. There will be Viva modules. There will be case scenarios that we will be taking up. There will be case discussions we will be taking. Case templates. Case templates mean if you have to summarize a case, if there is a child with fever with rash, how you're going to approach. If there is a fever of 5 days, how you're going to approach. Fever for 10 days, how you're going to approach. Fever for 2 weeks, fever with 3 months duration, how differential diagnosis is going to be. Those aspects we are going to take up in the coming days. There will be drug discussion, OSCE discussions, every system wise. We will have updates and journals, basics of ECG, X-ray, etc. I've already told you. There will be emergencies, doubt sessions, clinical spotters, and there will also be a segment on biostatistics, books to read, what news there, uh, and we'll be planning live sessions also once the app is fully functional and it goes live, and the course program is going to launch soon. End of the day, the aim of the course is not to replace clinical teaching, But if you want to crack exams, but at the same time, you also want to have that confidence when you sit in your university exam, when you present the case, and even if you are a practicing pediatrician or a senior resident, you want to learn some of the finer nuances and apply in your day-to-day practice. Those things also we will be updating, we will be adding to this. Like for example, things keep on changing. Like recently, fractional IPV has been introduced, and many of you know it, National Immunization Schedule. But many of the practicing pediatricians I met, they were like, we know about IAP, but we don't really know about what is happening to the fractional IPV part. And these are very busy pediatricians. So being busy in our professional life, we tend to lose out on the recent updates. And those are the things, those are the gaps that we will be trying to bridge here. Having said that, one last thing which I want to emphasize here is we are going to make it a dynamic program. What I mean by dynamic program is about 60 to 70% of the content will be something which we have decided. At the same time, there will be 30% bandwidth we'll be keeping on the app for what you people want. This is the only course of its kind. Yes, I will be discussing things which I feel, with my team of specialists feel are important for you. But at the same time, if you see cases, and there are particular number of cases, many of you are facing difficulties, we will be handling it. We will be discussing the clinical approach to that. Obviously, we cannot make the diagnosis. We cannot be replacing your college professors, and that is not our aim. The aim of this course is just to give you that push. If you have an exam coming up tomorrow, if you have a ward living coming tomorrow, if you have one easy posting, some community pediatrics or OPD posting coming, and you want to read something clinical which is likely somewhat important for MCQs, but more oriented towards being a better clinician, then this course is definitely going to benefit you. And obviously, we will be taking feedback and it will be continuously updated. So every month you will have new updates coming. Every month you will have new guidelines which are being changed. So we will be updating those. And that is what our aim is. So I hope this is more like, announcing before we start with the advertisements, before we start with the plans and the social media campaigns we do. I just wanted to come live without any script, without anything in my mind. I just wanted to discuss what we had in our mind and why we have created this course. So if you are a MD resident, if you are a DNB resident, if you are, suppose, a final year MBBS student, and you feel that pediatrics, you love pediatrics and certain segments you want, although it will be overdoing it because you have 19 subjects to read, but you can always have a look, or you can ask me for, what are the other things you will benefit out of it. But majorly, this course is created for residents, uh, post residents, senior residents, and those who are targeting the exam, who are preparing for super specialty, but also feeling it's all MCQ, 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 all Nelson, all theory. I'm losing out on my clinical acumen, something to make keep you clinically invested, something to help you crack your university exams, something to make life 10% easier, 5% easier, 2% easier in your vivas. That is what our focus is. It's not meant, I keep repeating, it's not meant to replace your bedside teaching, because what you read in your with your patients, with your professors, with your consultants, no course in this world can replace that. But if there is a gap, there is a scope for something additional if you need, that is what this course is about. I hope that's as candid as I can get about the course, right? So any queries from your end, you're most welcome. I'm sitting in the live chat and I'm turning on the chat box. So whatever doubts you have, whatever queries you have, you're most welcome to ask. The video started a bit late. We were waiting, we were hoping that some of our colleagues would be joining us, but as you know, as we all know, we are all pediatricians. Some of us are senior, some of us are junior. It is very tough for us to take out time. And, if there is a patient who gets sick at the last minute, that patient is the priority. So no problems. I'm speaking on their behalf as well. And we'll also be interacting together also in the coming days before we launch the product. So Harish has asked a question. Good evening. Good evening, Harish. Will there be bedside teaching on patients, or like piku niku sessions like ventilation, Harish Reddy, there are a few things I need to emphasize. First of all, whatever the way we have created a course, one problem that we have faced in this program is the problem of consent. We have tried to be ethical, and all the videos, all the cases, and everything which we have used, there is a proper informed consent in that. When you try to live stream or record fine detailed discussion on the bedside, what creates problem is many times there are distractions, or many times the patients are not comfortable showing it to you. So wherever possible, we have taken scenarios, we have taken photographs also, but we have done it in an edited manner so that you don't get one case discussion going on for 3 hours. We have tried to keep it concise, and in the coming days, we will be adding long, short, and spotter cases as well. In addition, about PICU and NICU ventilation strategies, Dr. Parag is the best person to answer that. But yes, we will be talking about the basics of ventilation. We will be talking about basics of ventilation, and ventilation things a resident should know will be handled by myself. Complex diseases, ARDS management, pneumothorax management, HFOE ventilation related points. I'm not the right person. Dr. Parag is the right person, and sir and his team will be taking it up there. So yes, that will definitely be there. As soon as we launch, immediately what you will be getting access is the history taking examination, case scenarios, OSCEs, and the ventilation videos are right now being recorded. And as they keep getting recorded, we'll keep updating. As I said, it's a dynamic course. And many times we would have recorded a case, and there would be a better patient with a totally different scenario coming up. We'll be immediately recording, editing it, and putting it up on the app. So it's going to be a dynamic course as well. What goes up will not be taken down, but you will have material being added almost on a fortnightly or a weekly basis. And I keep repeating, it's not a replacement for your NICU PICU posting. It's not a replacement for your bedside teaching. Clinical manuals you should read, but it will just be summarizing, helping you out in an interactive manner. That is what our aim is. It's not to replace something. I'll give an example. Like I've decided that a snippet of that video also I will be releasing. Like some weeks back, I saw a patient. I attended a delivery actually, where there was a prenatal diagnosis made of polyhydramnios, and the baby had cleft palate. Intrauterine, it had been diagnosed, but there was no trisomy, anything. Markers were done; they were all negative. So when the child was born, initially, when of course I knew like what the basic management had to be done, and we did the all the consultant calls also. But at the time, I realized that if I'm a resident and I am attending a cleft lip or cleft palate delivery, theory about cleft lip and cleft palate is there in NSEL, but it is all scattered. How you are going to summarize, how you are going to manage, that becomes a bit troublesome. Apneic patient, case scenario, patient becomes apneic in front of you. What should you be immediately doing? Should you be, and you've given one dose of caffeine citrate, after how much time you should be giving another mini bolus? Those things in a practical manner, they are there in the books, but often we when we need it, we don't find them. So those common case scenario kind of things also we have taken. Like there are segments where I have told that suppose there is a patient who has this scenario, like it's not a part of the case, this scenario, this happened, with a photograph, what is the next thing you are going to do, not from a MCQ perspective, in a real life perspective. So our aim has been real life perspective. Of course, it's a totally different thing, nobody has done that. So it is, we are going to take your feedback as well, and we hope that it is going to appeal to you. But at the same time, based upon your feedbacks, we'll be keeping adding more cases, more scenarios on a regular basis as well, but without wasting your time. We don't want it to be a 300-hour course, 400-hour course, where uh, you have the course in your app, but you're not able to see it because you don't know, it's too bloated. We want to keep it concise. So I think that's the message I wanted to share. Any more queries from your end? If there are, I would take them up. Otherwise, apart from that, I would be coming out. This is more like a, not even a promo. It is a teaser for the promo. That is what I have said. So the course is coming. That entire team has worked very hard. We have put our heart and soul into it. It's not a perfect product, but it will get perfect based upon your feedbacks and the way it is has been framed. We personally feel that if you take out at least 15, 20, 30 points out of this, those 30 points, if you have not known, at least you would know them better, and they are going to make some difference, small difference, in your clinical acumen, in your case presentation, in your not running around for information in a clinical manner for those particular points. So that is what our aim is, right? So I hope everyone benefits out of it. And in case there are no more queries, I can close this session. But next, we'll be coming out with some snippets of how we have created the course. And more other subject experts will also be coming. We'll be out with more details. And the course launches soon. Please stay in touch. If you are a pediatric resident and you feel you will benefit out of it, why not? So this is me, Dr. Sandeep Sharma. All of you, many of you are connected with me through social media also. So please connect with me and do ask if you have any queries. So the details of the program release soon. Thank you so much. And Samir is asking when it will be out approximately, sir. Samir, uh, right now it is in beta mode. So testing is going on. The tentative date which has been told is somewhere before. That is what we are targeting before Christmas. But definitely in December, the course will be launched. Definitely in December. So 24, before 24 comes, you will have the course in available. So thank you very much. And those who will be seeing this video in a recorded manner, you can always message me in the comments or message me personally also. Thank you so much, and God bless everyone. And I hope you all remember the thing which Dr. Singhi told me, my boss, when he was my HOD, when he had taken our first orientation session. A child is not a miniature adult, and the next 3 years of your MD are going to be tough, but they are also going to be worth it. This is what Sir said. I still remember, and I still quote Sir whenever I take a residence class. So Javed Bani, as I said, Javed, it is not a MCQ based course. There are super specialty programs running. My colleague, I have a super specialty program. Dr. Doodles has a super specialty program. My colleagues, some of my senior colleagues also have their programs. They're all MCQ oriented. See, if you say that if I teach something about cleft lip or palate or infant of diabetic mother, can a MCQ be asked from that? Definitely it can be asked. But have I created it keeping in SS mind? No. When I've talked about, for example, I've discussed about AOCN guidelines in 30 minutes of febrile seizure. I've talked about AOCN guidelines of West syndrome in 20 minutes. I've talked about GERD latest guidelines in 15 minutes. So those 15 minutes, I have summarized what the big, those 8 pages, 9 pages PDFs are there. So I've summarized in a similar manner where I am talking about it and there is animation coming at the back. Only the highlighted points are there. So yes, tomorrow if there is a super specialty question from a GERD guideline update, that will be benefiting. But is it meant for super specialty exam per se? No. The aim is clinical orientation, clinical exams, better clinical skills, and to help you in your university exam, in your cases on a day-to-day basis. Right? So thank you, Harish. Thank you so much. You're most welcome. And even we are excited. And let's see. We're working very hard right now. My face looks a bit tired. Before I started the session, two people asked me, sir, first, let's first launch the course. I have to orient my students. And we are also working very hard. We hope the course comes out on time. We are hoping it will come out before Christmas. That's what our aim is. And I hope you all benefit from it. So thank you so much, and thank you for connecting. And we meet again. A snippet, sample video of what we have created, the way we have created, goes out soon on Dr. Tutorials SS channel. So please subscribe to the channel, and for updates, you will be getting. Thank you so much. God bless everyone. Go back to your managing your kids. Bye bye. Yes, Raghav, similar courses coming. Uh, Big team of